in this session, I will be discussing embolism. So what is embolism? What is an embolus? How to define an embolus? So embolus is a detached intravascular mass. Now it can be solid, it can be liquid, it can be gaseous. So basically it is a detached intravascular mass present either in the artery or present in the vein. It can be solid, it can be liquid, or it can be a gaseous mass that is carried away by the blood from the points of its origin to a distant site, and it is often causing obstruction at that site. Because it is causing obstruction at that distant site, that's why it produces tissue infarction or tissue dysfunction. So this is an embolus, and the mechanism, the phenomenon is known as embolism. So embolus is a detached intravascular mass. It can be solid, it can be liquid, it can be gaseous, and it is carried by the blood from the point of its origin to a distant site where it is producing obstruction, and because of obstruction it is causing tissue dysfunction or tissue infarction. So we can say that it is a transported intravascular mass which is detached from its site of origin. It is known as embolus. So this is embolus, and the phenomenon is known as embolism. I would like to draw a diagram to explain you. So you can see this is an organ. Here I am drawing an organ. We know all organs are supplied by pure blood by artery. So this is the artery of that organ. See the blood supply. It is supplying oxygenated blood to this organ. All the organs drain in vein. So this is a vein. It carries deoxygenated blood away from the organ. So you can see this is an organ. Now inside the artery or inside the vein, I am drawing a detached intravascular mass. So the detached intravascular mass, here these things I am drawing, these are embolus. The embolus can be present in artery or it can be present in the vein. It can be bland or it can be infected. It can be solid, it can be liquid, it can be gaseous. So this is the embolus. It can be solid, it can be liquid, it can be gaseous. It can be present in the artery, you can see. It can be present in the vein, you can see. So it is causing obstruction to the flow of the blood in this organ. So this organ will undergo either infarction or dysfunction, since it is causing obstruction to the blood flow. This is embolus. So you can see this is embolus or this is embolus. So one is arterial embolus present in the artery, one is venous embolus present in the vein. So this is the definition of the embolus. In this diagram also, you can appreciate this is a blood vessel. Inside the blood vessel, you can appreciate this is a thrombus. This is a thrombus, it is formed. So till the thrombus is attached to the wall of the blood vessel, it is known as thrombus. Once the thrombus is detached from the wall of the blood vessel and start flowing in the blood, now thrombus is no more thrombus. Now it is known as embolus because it is detached and it is freely moving in the blood. So a detached thrombus is known as thromboembolism, which is the most common source of embolism. So you can appreciate thromboembolism here. Now we have done the definition of embolus. We understood what is embolus. Now coming on the classification of embolism. How to classify embolism? We can classify embolism based on 4 criteria. We will be discussing these one by one. So what is the classification of embolism? The first, depend on the matter, whether it is solid or liquid or gaseous. Depend on the matter present inside the emboli, we classify them. Second, we classify them whether they are infected or not infected. That is the second classification. Third, we classify them depending on the source of the emboli. So whether they are present in artery or vein or lymphatic or heart, so that is the source of the emboli. And last, we classify them depending on the flow of the blood. So let me show you these 4 classification of the embolism one by one. Let me come on the first one, depending on the matter. As I have told you, the first one is the depending on the matter present in the emboli. So it is of 3 types: solid, liquid and gaseous. So depending on the matter, physical state of the embolus. So solid, the examples are, it can be thromboemboli, that is a detached thrombus is no more thrombus. It is known as thromboembolus. It can be atheromatous material, it can be tumor cell clumps, it can be parasites or bacterial clumps, it can be foreign body. All of them are solid. Coming on the examples of liquid, in the liquid fat globules can be there, amniotic fluid can be there, bone marrow can be there. These are the examples of the liquid. And in the gaseous, air embolism is there. So solid, liquid, gaseous. That is the first classification, and you can see various examples of the emboli inside each of them. Coming on the before coming on the second type, you can see the diagrams of each of them. Here you can appreciate this is a thrombus. Till it is attached to the wall, it is known as thrombus. Once this thrombus is detached from the wall of the blood vessel. This is a detached thrombus. It is known as thromboembolism. It is a solid one. It is an example of solid embolus because the thrombus is solid. Coming on the next example, here you can see it is the fat globule. Let me mark. This one is the fat. This one is the fat globules. So it is an example of liquid one. So fat embolism is an example of liquid embolism. Here you can see this is an amniotic fluid. So it is also an example of liquid embolism. And in this example, you can see an air bubble. Air bubble is an example of gaseous embolism. So these are the various types of embolism based on the physical matter of the embolus. Now coming on the second classification is based on whether the embolus is infected or not infected. Based on this criteria, the embolus are of two types. Either they are septic, that is they are infected, or they are sterile, that is they are bland. So bland and septic are the two types. Bland means they are sterile, they are not infected, and septic means they are infected. So they are of two types based on this criteria. Coming on the third criteria of classification, based on the source of the embolism, embolism are of four types. First, cardiac embolism, they arise in heart. Second, arterial, they arise in the artery. Venous, they arise in the veins. And lastly, lymphatic. So either arterial, venous, lymphatic and cardiac. That is the source from where the embolus is arising. That is the source of the embolus. And last classification depends on the flow of the blood. Usually embolus flow in the direction of the flowing blood, but sometimes it may flow opposite to the direction of the flowing blood. So such an embolus is known as retrograde embolus. So a retrograde embolus is an embolus in which it travels against the flow of the blood. That's why known as retrograde. It is very rare, but it can happen. The second type is the paradoxical embolus. What is paradoxical embolus? Now imagine an embolus arising in the artery. It will remain in the artery only. Various arteries, it can flow from one artery to other, but it will remain in the artery only. If the embolus is arising on the venous side, it will remain in the vein only. But is it possible for an embolus to cross from the arterial side to venous side, or vice versa from the venous side to arterial side? Yes, it is possible. So how it is possible? Through the patent foramen ovale. So any embolus crossing from the venous side to the arterial side, or a vice versa from arterial side to venous side through a patent foramen ovale, it is known as paradoxical embolus. So we have understood the two type of embolus, retrograde embolus and paradoxical embolus, depending on the flow of the blood. Here in this diagram, you can appreciate this is the patent foramen ovale. Appreciate this is patent foramen ovale. So through this patent foramen ovale, an embolus is traveling from right side of heart to left side of heart, or from left side of heart to right side of heart. That is from arterial side to venous side, or from venous side to arterial side. So this is paradoxical embolus. Here also you can appreciate through patent foramen ovale. This is the embolus. It is crossing the patent foramen ovale and moving from right side of heart to left side of heart. These are the examples of paradoxical embolus. So we have classified embolus based on four criteria. The first criteria based on the physical matter of the embolus, whether it is solid or liquid or gas. So that is the physical matter. The second criteria is based on whether the embolus is infected or non-infected. So based on that, it is of two types, that is sterile and bland. Bland and septic. These are the two types. Coming on the third criteria, what is the source of the embolus? So whether it is arising in the artery, arterial embolus, if it is arising in the vein, venous embolus, if it is arising in the heart, it is known as cardiac embolus. And if it is arising in the lymphatic, it is known as lymphatic embolus. That is the third criteria. Fourth criteria based on the flow of the blood. Usually embolus flow travel in the same direction as the blood is flowing. But sometimes the embolus flow opposite direction as that of blood flowing. So such an embolus is known as retrograde embolus. Number one, that is retrograde embolus. And sometimes the arterial embolus can come on the venous side, or venous embolus can come on the arterial side. Such an embolus is known as paradoxical embolus. So this is the classification. After classification, we will be discussing some important type of embolus. So what are the important type of embolus that we will study in detail? Number one, thromboembolus. The second, fat embolus. The third, gas embolus, air embolus, whatever. And fourth is amniotic fluid embolus. So these four embolus we will be discussing in detail one by one. Let's start with the first one. That is thromboembolus. So let me start thromboembolus. So what is the definition of thromboembolus? Thromboembolus is a detached thrombus. That's why known as thromboembolus. It is a detached thrombus. Till the point the thrombus is attached on the blood vessel wall, it is known as thrombus. But once it is detached from the blood vessel wall, it is known as embolus, and such embolus is known as thromboembolus. It is the most common type of embolism. That is 90% type of embolism is this one only, that is thromboembolism. Here in the diagram also you can appreciate till it is attached to the wall, it is known as thrombus. But once it is detached from the wall and start freely moving in the flowing blood, this is known as embolus. So thrombus converted to embolus, and such embolus is known as thromboembolus, which is the most common type of embolus, that is 90% of the embolus. So this is the diagram you can see. Now it can arise in the artery, so arterial thromboembolus. It can arise in the vein, so venous thromboembolus. We will be discussing both of them one by one, arterial and venous. So coming on the arterial, if any embolus is present in the artery, so you can imagine, let me draw a diagram for this, for understanding. You can understand this is a organ. This is a organ. This is the artery of that organ, and this is the vein of that organ. So you can see the blood flow in the artery, the blood flow in the vein, the direction of the blood flow. Now imagine the embolus is present in the artery. I am teaching you arterial thromboembolus. So this is the embolus causing obstruction in the artery, causing narrowing, causing obstruction in the blood flow of that organ. So this organ, this particular organ received less oxygenated blood, less pure blood. That's why organ undergo infarction, organ undergo gangrene if it is lower limb. If it is heart, this organ is heart, it undergo MI, that is myocardial infarction. If it is brain, it can undergo sudden death because of cerebral artery embolism. Depending on the organ, various effects are possible if the embolus is present in the artery of that particular organ. Sometimes collateral circulation is developed. Because of the obstruction in the main artery, the collateral arteries are developed to supply blood to this organ. So that is the arterial emboli. In arterial emboli, the artery is obstructed, so oxygenated blood to that particular organ is decreased. So to compensate, body form collaterals, or sometimes infarction, gangrene, MI, sudden death, stroke. These are the findings depending on the organ of arterial embolus. Here also in this diagram you can appreciate an artery. Inside the artery, if you can appreciate, this is the embolus. This is the embolus traveling in the artery. So due to the traveling here, due to the narrowing of the artery, it is causing complete obstruction in the artery. So this artery is supplying pure blood, oxygenated blood to some organ. That organ will receive less blood now, and that will undergo infarction and gangrene, right? So that is the arterial thromboembolus. The end result is infarction. The end result is gangrene. The end result is MI, depending on the organ. Mostly it is infarction, some type of infarction, and necrosis. Coming on the venous thromboembolism. What about the embolus which is present in vein? How does it will present? So before presentation, tell me the sources of venous thromboembolism. Tell me the name of the veins from which it basically arises. Most commonly, it arises from deep vein of the lower legs. It is known as deep vein thrombosis of the lower leg, DVT of the lower leg. Most common vein. After that, it can be pelvic vein. It can be veins of the upper limb. It can be cavernous sinus veins in the brain. It can be right side of the heart. So embolus can arise anywhere in this vein, but most commonly it is the deep vein of the lower limb. That is the sources. You can see these are the deep vein of the lower limb. Please appreciate. If I zoom out, you can see first a thrombus is formed, and once the thrombus got detached, it got converted into embolism. So such an embolism is thromboembolism inside the veins of the leg, deep veins of the leg. So this is a venous thromboembolism because it is present in the veins of the leg. So this is how it arises. Now, what is the effect of venous thromboembolism? Where it will go, where it will cause obstruction? Okay, you can see this diagram to understand this. You can see this is an organ. This can be any organ of the human body. All organs of human body drain in veins. So the vein of all organ, it can be any organ, it drains in vein. Vein of all organ ultimately go in superior inferior vena cava. So this is superior and inferior vena cava. SVC, IVC, superior inferior vena cava. So superior inferior vena cava opens in right side of the heart. Now imagine any organ is having an embolism in the vein. So let me draw an embolism. So this is the vein of any organ, and I am drawing the embolism inside the vein. So embolism will also travel in the direction of the blood flow, and all the embolism present in any vein of throughout organ of the human body, it will reach in SVC, IVC. Superior inferior vena cava. So embolus is reaching in superior inferior vena cava. After superior inferior vena cava, the embolus is reaching on the right side of the heart. From the right side of the heart, the embolus is going to the right auricle. It is going to the right ventricle. From right ventricle, the embolus are going to the pulmonary artery. You know the flow. From the pulmonary artery, ultimately, it reaches the lung and causing pulmonary embolism. So this is the end result of venous thromboembolism. if there is a embolus in the vein of any organ, ultimately that embolism is traveling and causing obstruction in the lungs. So it will lead to pulmonary embolism. So pulmonary embolism is the end result of any venous embolism. All the venous embolism ultimately cause obstruction in the lungs. So that is pulmonary embolism leading to venous thromboembolism leading to pulmonary embolism. The diagram is in front of you. So that is the thing. Can you appreciate in this diagram? This is a vein of the leg. This is the zoom version. You can see in the vein of the leg, this is the embolus which is present. And it is following the same route and ultimately it is reaching the lungs. You can see it is causing obstruction in the lungs, in the pulmonary capillaries of the lung. So this is venous thromboembolism leading to pulmonary embolism. Inside the lungs, you can appreciate these are the embolus. Let me draw the embolus inside the lung. This is the embolus inside the lung causing obstruction in the lung, causing pulmonary embolism in the lung, right? So what is pulmonary thromboembolism? Pulmonary thromboembolism, it is a pulmonary embolism. It is the most common and fatal form of venous thromboembolism. Here the occlusion of pulmonary artery take place because the embolus is present in one of the vein. All the veins drain in SVC, IVC, and from the complete route it is coming in the lungs. So you can appreciate this is the leg vein. Start from the leg vein. Inside the leg vein there is stasis, there is hypercoagulability that lead to thrombus formation. So please appreciate there is a thrombus in the leg vein. So what is the pathogenesis? You tell me the complete pathogenesis of pulmonary thromboembolism. It is very important for the exam. Ultra important topic for the exam, pulmonary thromboembolism. So whenever there is stasis or hypercoagulability of the blood in the lower limb legs, so it will lead to thrombus formation. It is known as deep vein thrombosis, DVT. It is very common. So once the thrombus get detached, it got converted to embolism. Now the embolism is present in the vein of that particular organ. You can see this is the organ. Here I am talking, the organ is the leg. Usually it is a leg. So leg veins have thrombus due to hypercoagulability or stasis. The thrombus got detached and the thrombus got converted into embolism. So embolism is present in the vein. From the vein it is going to SVC, IVC. From SVC, IVC, superior inferior vena cava, it is going to right side of the heart. In right side first it is going to right auricle. Then through tricuspid wall it is coming to right ventricle. From right ventricle it is coming to pulmonary artery, and from pulmonary artery it is going to the lungs and causing pulmonary embolism there. So the complete route is written in front of you in the form of the flow chart. This is how you have to write in the exams. So first, due to stasis or hypercoagulability of state, a thrombus is formed in the veins. The thrombus got detached. It got converted into thromboembolism. This thromboembolism is present in the veins. From the veins, it is going to SVC, IVC, superior inferior vena cava. From there, it is going to the right side of the heart. From there, it is going to right auricle. From there, it is going to right ventricle. And then it is going to pulmonary artery and ultimately causing pulmonary embolism. So this is how a pulmonary embolism is established. You can see the complete pathogenesis in the form of the flow chart also. The same thing you can appreciate here in the diagram also. How from the veins of any organ, ultimately it is resulting in pulmonary embolism. This is the end result. So the pathogenesis is in front of you. If the thrombus is large, it will get impacted in the bifurcation of the pulmonary artery and it is known as saddle embolus. You can appreciate here in this diagram, this is the bifurcation of the pulmonary artery. Okay, let me draw the pulmonary artery. This is the main pulmonary artery. It is dividing into two branches by bifurcating. This one is right and this one is left. So you can appreciate the bifurcation of the main pulmonary artery into the two trunks, right and left. You can appreciate this one is embolus. I am drawing with red color. If the embolus is large, it will get impacted at the bifurcation. Now such an embolus is known as saddle embolus. Saddle embolus. See the shape. The shape is saddle shape. That's why it is known as saddle embolus. The saddle embolus, it is impacting at the bifurcation of the pulmonary artery that you can appreciate. Now, what are the consequences of pulmonary embolism? There can be multiple consequences. If the embolus is large, that is saddle embolism causing obstruction at the bifurcation of the pulmonary artery, sudden death can happen. If the embolus is very small, so it is distributing everywhere in the pulmonary circulation, it can resolve with time. So sudden death till resolution, anything is possible. So this is the range, either resolution or sudden death, anything can possible. Apart from it, pulmonary infarction, pulmonary hemorrhage, pulmonary hypertension and acute cor pulmonale. These are the end results. These are the fate of pulmonary embolism. So we are done with thromboembolism. In thromboembolism, we have seen how a thromboembolism arises. It is arising from the detachment of a thrombus. So an embolus arising from the detachment of the thrombus, such an embolus is known as thromboembolism. It can present in the artery, it can present in the vein. If it is present in the artery, it will cause infarction and necrosis of that particular organ to which that artery is supplying. If it is present in vein, whatever organ vein, ultimately it will result in pulmonary embolism. So what is the end result of arterial thromboembolism? It is infarction and necrosis of that organ. What is the end result of venous thromboembolism? It is pulmonary thromboembolism. So that is about thromboembolism. Coming on the second important embolism, that is fat embolism. Let me start fat embolism. What is fat embolism? So fat embolism, here the obstruction of the arteries and veins is caused by fat globules. So see this diagram. In this diagram, please appreciate this is a fat globule. These are the fat globules. Please appreciate these are the fat globules which are forming a clot and they are causing obstruction either in the artery or in the vein. Now listen, all type of embolus, whether thromboembolus, fat embolus, gas embolus, amniotic fluid embolus, all can be present in the artery, all can be present in the vein. So all of them can be of two types. If they are present in artery, they will produce systemic effects, that is infarction and necrosis of that particular organ. If any one of them is present in the vein, ultimately it will result in pulmonary embolism. So that is the thing. So here for fat embolism also, the composition is different. It is not made up of thrombus, it is made up of fat globules, but it can be present in the artery, it can be present in the vein. Now, what is the pathogenesis? How a fat embolism is formed? Etiology is of two types, traumatic and non-traumatic. So what are the traumatic causes? If there is this is a bone marrow. You can appreciate this is a long bone. Inside the long bone, there are two types of bone marrow, red bone marrow and yellow bone marrow. In the yellow bone marrow, fat is present. Now imagine this person is having a fracture of a long bone. So this is a fracture of the long bone. Since the long bone got fractured, the yellow bone marrow will leak in the blood. The yellow bone marrow contains fat. So fat globules will come in the blood and they will clot, they will form a clump and they produce the fat embolism. So this is the traumatic cause. Trauma to the bone or trauma to the soft tissue. So due to the trauma to the bone, due to the fracture in the long bone, it leads to the passage of fatty marrow in circulation. So fatty marrow is the yellow marrow containing fat globules and they will clot, they will clump together and they will form a fat embolism. In the non-traumatic causes, there are multiple causes. It can be burns, it can be diabetes mellitus, it can be fatty liver, pancreatitis, sickle cell anemia, decompression sickness, inflammation of the bones and soft tissue, extrinsic fat or oil introduced in the body, hyperlipidemia or cardiopulmonary bypass surgery. These all causes are non-traumatic causes. Still, the person is having a fat embolism without injury to the bone and the soft tissue. Now, what is the pathogenesis behind each of them? For traumatic cause, the theory is mechanical theory. This is the mechanical theory. It holds good for traumatic cause. It can explain why after a trauma to the bone, to the long bone, it produces fat globules because of the leakage of the fat globules released from the injured area in the blood. It's very simple. But what about non-traumatic cause? Why in burns, sickle cell anemia, decompression sickness? Why the person is having fat embolism in those scenarios even without trauma? So there is another theory known as emulsion instability theory that can explain the mechanism. So in emulsion instability theory, it explains the pathogenesis of the fat embolism in non-traumatic causes. So here fat embolus are formed due to the aggregation of plasma lipid, due to the disturbance of natural emulsification of the fat. So basically in all these causes, the natural emulsification of the fat is disturbed and that can cause accumulation of the lipid and that can lead to fat embolism. So this theory is emulsification theory. Emulsification instability theory. So there are two theories which explain the pathogenesis or mechanism of formation of fat embolism. The mechanical theory explains the traumatic causes and emulsion instability theory explains non-traumatic causes. So these are the two theories which holds good. Now coming on the consequences of fat embolism. The consequences of the fat embolism depends on four criteria. What is the size of the fat globules? What is the quantity of the fat globules? Whether they are present in the artery or present in the veins. So it is of two types, arterial and venous. Arterial one is the systemic one. Systemic one is the arterial. Now if it is present in the artery, so it depends on which organ artery it is causing obstruction. So imagine this is the organ. If this organ is brain, and And if the embolus is present in the artery, this is the artery of the brain, this is the vein of the brain. I'm saying embolus is present in systemic circulation means it is present in the artery. So you tell me, if the embolus is present in the artery of the brain, it is causing obstruction of blood flow in the brain. So what are the symptoms? Patient can have petechial hemorrhage in the leptomeninges of the brain. Patient can have hemorrhages in the parenchyma. Patient can have CNS symptoms like delirium, convulsions, stupor, coma, sudden death. These are the symptoms when there is obstruction in the brain circulation, when there is an embolus in the artery of the brain. Now, instead of brain, if this organ is kidney, imagine if this organ is kidney, not brain, then what are the symptoms? Then the symptoms can be, if it is kidney, then symptoms can be renal fat embolism present in the glomerular capillaries causing decreased glomerular filtration. So it leads to renal insufficiency. So depending on the organ, that organ will have infarction and necrosis because the arterial supply, the oxygenated blood supply of that particular organ is hindered. So that is the systemic fat embolism. Now coming on the second fat embolism is pulmonary fat embolism. Pulmonary fat embolism is the venous embolism. It is the venous embolism. The pulmonary fat embolism is the venous embolism. It is the patient dying after the fracture of the bone. If the bones got fractured, numerous fat emboli will come. It will leak it will come in the vein. From the vein, it will go to SVC-IVC. From SVC-IVC, it will go to right side of heart and ultimately it will reach the lung. And it can cause pulmonary fat embolism. It can lead to hyperemia, edema, petechial hemorrhage and fat globules in the pulmonary capillary and alveolar spaces inside the lung. Now, you can imagine there is an orthopedician and he is having a case, a patient having a fracture in the femur or humerus or any long bone. So it's very common having road traffic accident and one of the long bone got fractured and the orthopedician is fixing it. So the fracture got fixed. But imagine 1 or 2 days after the fixation of the fracture, the patient suddenly have respiratory insufficiency and because of which the patient is dying. Now, in a simple case of fracture, why the patient is dying because of respiratory insufficiency? So, autopsy is done. So, in the autopsy, the doctor who is performing, the person who is performing the autopsy, he should take the lungs out. Most common cause of death here is fat embolism, which is producing pulmonary thromboembolism. So, inside the lung, inside the capillaries of the lung, pulmonary capillaries, look for fat globules. Or you can use the special stain in the autopsy. In the lung autopsy, you can use the special stain for the fat, that is Sudan dye or oil red O or osmic acid. You can see this is the oil red O. In the oil red O, the fat globules are seen red color. All these red color is the fat globules. It is the slide of a pulmonary capillary. You can see the slide of a lung. So the fat globules are present inside the pulmonary capillary as well as inside the alveolar spaces. So this is a typical case of pulmonary thromboembolism produced by fat embolism, which is the cause of death here. You can see this is Sudan black. In the Sudan black, the fat globules are seen as black color. This is a fat embolism. This is a fat embolism. All the fat embolism are present in alveolar spaces. So this is the thing. So we are done with thromboembolism. We are done with fat embolism. Now I'm starting the third embolism, that is amniotic fluid embolism. So let's start amniotic fluid embolism. What is amniotic fluid embolism? It is the most serious, unpredictable, unpreventable cause of maternal mortality. Basically, it is the 5th most common cause of maternal mortality in the world. So it can cause maternal mortality. What is amniotic fluid? You can see this is the uterus of the mother. Can you appreciate the uterus of the mother here? Inside the uterus of the mother, a fetus is present. The fetus is surrounded by a sac and there is a fluid present in the sac. This fluid is amniotic fluid. How this amniotic fluid is coming in the blood? How it is coming in the artery and the vein producing amniotic fluid embolism? So what is the pathogenesis? So here the amniotic fluid is coming in the blood. The amniotic fluid which is present around the baby, around the fetus, inside the uterus of the mother in the sac. So that amniotic fluid is coming in the blood and forming a mass there, usually in the veins. It is known as amniotic fluid embolism. Can you appreciate? This is amniotic fluid embolism. It is made up of amniotic fluid, the same fluid which is present around the fetus. Now the question arises, how this fluid which is present around the fetus in a pregnant lady, how it is coming in the veins? How it is coming in the blood, that is in the artery and vein. So what is the pathogenesis? So basically during labor, the uterus does vigorous contraction. So during labor, there is vigorous contraction in the uterus. It can produce tears in the myometrium and endocervix. And the amniotic fluid is forced into the uterine sinusoids by vigorous uterine contraction. So imagine the lady is having labor pain, and during labor, the uterus is contracting vigorously. So there are tears in the endometrium, tears in the endocervix, and due to the vigorous contraction, the amniotic fluid which is present around the fetus, it is forced or pushed in the sinusoids, that is the veins and the capillaries present inside the uterus. So this is how during labor and immediate postpartum period, the contents of the amniotic fluid enters the uterine vein due to the vigorous contraction, producing tears in the endometrium and the uterus. So ultimately all veins drained in the right side of the heart, right auricle, right ventricle, through superior inferior vena cava, and ultimately it will go to the pulmonary artery and reaches the pulmonary embolism. So it is producing pulmonary embolism. So you can appreciate this is the pregnant lady. Inside the pregnant lady, you can appreciate this is the uterus. Inside uterus, appreciate the fetus, appreciate there is amniotic fluid. Now during labor, due to the vigorous contraction, there are tears in the uterus, and from these tears, the amniotic fluid is forced or pushed in the uterine veins. And from uterine veins, ultimately, it is reaching the right side of the heart and reaching in the lungs, producing pulmonary embolism. Imagine a lady who is pregnant and immediately after vaginal delivery, after postpartum, due to the vigorous contraction of the uterus, she dies. So what is the most probable cause of death? The most probable cause of death in this case is amniotic fluid embolism. Now, during autopsy of such a lady, it is very necessary to look for the amniotic fluid embolism in the lungs, in the pulmonary capillaries and alveolar spaces. So what is the composition of amniotic fluid component? Amniotic fluid embolism. It can contain epithelial squeams, it can contain vernix caseosa, it can contain lanugo hairs of the fetus, bile from the meconium and mucus. So see, you can appreciate the composition, you can appreciate the squeams, you can appreciate the hairs and squeams present in the lung of the mother. All this is present in the lung of the mother. So inside the lung of the mother, squeams of the baby are present in the form of the amniotic fluid embolism, that is producing pulmonary embolism. That can be the cause of death in this scenario. The lady can have sudden respiratory distress and dyspnea, deep cyanosis, cardiovascular shock, convulsions, coma, and ultimately death. So this is the end result of pulmonary amniotic fluid embolism. So we are done with thromboembolism, fat embolism, amniotic fluid embolism. Now the last important embolism to be discussed here is gas embolism. So let me start with gas embolism. In gas embolism, as the name indicates, a gas, one of the gas, usually air, nitrogen or other gas, that can produce bubbles in the circulation. Now see here in the diagram, can you appreciate a bubble? This is a bubble in the circulation. This bubble is the air. Now it is of two types, either air embolism or decompression sickness. Both comes under gas embolism. It is having two main variants, air embolism and decompression sickness. We will be discussing them one by one. In air embolism is made up of air present in the circulation, air bubble in the circulation, either in the artery or in the vein as usual. So you can see here in this diagram also, this is the air present in the vein. Air can be present in the artery, it can be present in the vein. So what is the origin? How air got introduced in circulation? What is the origin of air embolism? So there can be various causes. The most important is operation of head, neck and trauma. During the operation of head, neck, there can be accidental opening of the major vein in the neck like the jugular vein, and the air got introduced there in the jugular vein, the atmospheric air. That can produce a bubble in the jugular vein and that can produce air embolism. During obstetric operations also, during childbirth, the normal vaginal delivery or cesarean section or abortion, entrance of the atmospheric air in the opened up uterine sinuses and endometrial veins. So this can also happen. Sometimes due to accidental intravenous infusion of the air during IV injections. You can appreciate this is an IV injection. Before giving the IV injection, all the air present in the syringe, it should be taken out and then introduced in the body of the patient. So sometimes due to accidental entry of the air bubbles via IV injections and fluids, right? Now, venous air embolism. If the air embolism is present ultimately in the veins. So as we know, ultimately if it is present in vein, it will go in the lungs and it will produce pulmonary thromboembolism. So after air embolism, the patient can suddenly die because of respiratory distress and cyanosis. So that is the cause of death is pulmonary embolism produced by air embolism. So that can happen. So during the autopsy, if the death occurs from the pulmonary air embolism, it is suspected. Then during autopsy, the heart and the pulmonary artery should be opened in situ underwater. Can you see here? inside the lungs, this is the air embolism appreciated on an X-ray. And the air can be seen in the form of the bubbles when the heart and pulmonary trunk is opened underwater, in situ underwater. Now coming on decompression sickness. It is one of the type of the gas embolism. Decompression sickness is a special type of gas embolism. It is known by various names. It is known as Caesian's disease. It is known as diver's palsy. It is known as aeroembolism. These are the various names given to the decompression sickness. Now, during pathogenesis, what is the pathogenesis of decompression sickness? So, when a person decompresses suddenly, it will produce decompression sickness. What do you mean by decompression? When a person decompresses suddenly means when it is coming from high atmospheric pressure to normal atmospheric pressure, or from normal atmospheric pressure to low atmospheric pressure. It can produce the decompression sickness. So if divers are there and they are descending, you can see in this diagram, this is a diver. Please appreciate, this is a diver. So there is a rule in the chemistry. Whenever the pressure is there, the solubility of the gases increases. So pressure is directly proportional to solubility of gas. This is a law in chemistry. We have learned this law. Pressure is directly proportional to solubility of the gas. Now, whenever the diver is going deep in a sea, this is the diver going deep. So pressure increases. When the pressure increases, all the gases will be soluble in the blood. Basically nitrogen, oxygen, carbon dioxide, all the gases will be soluble. So whenever the diver is going deep, you can appreciate the diver is going deep, so pressure increases. If the pressure increases, solubility of the gas increases. Now the diver is ascending. Now this is descent. This is descent. During descent, solubility increases because pressure increases. But during ascent, the pressure goes on reducing. When the diver is coming upwards, pressure gradually decreases. So solubility, if the pressure decreases, solubility also decreases. So solubility of the gas decreases, so the gas will come in the form of bubbles in the circulation. This is how it is producing air embolism during ascent. So air embolism is produced during ascent, not during descent. So during ascent, this individual, the diver, will have multiple air embolism in the circulation. It can be in the artery, it can be in the vein. So it can produce obstruction in the joints, causing pain in the joints, known as bends. It can produce obstruction in the lungs, that is known as chokes, and it can produce obstruction in the brain, causing vertigo, coma, and death, that is cerebral effects. So obstruction can occur anywhere. You can appreciate the obstruction in the joints, the obstruction in the cutaneous circulation, producing pateki. So that is known as decompression sickness. So what we have learned in this session, what is the summary of this session? We have learned what is an embolism. What is an embolism? Basically, embolism is a detached intravascular mass. It can be solid, it can be liquid, it can be gas. It is carried by the blood from the point of its origin to a distant site where it is producing obstruction to that organ. If it is producing obstruction to that tissue, the tissue undergo infarction or dysfunction. So it is a transported intravascular mass detached from the site of origin. It is known as embolus, and the phenomenon is known as embolism. That is the definition. We have learned the classification of embolism. We can classify embolism by 4 ways. First, depending on the matter present inside the emboli, it can be solid, liquid, or gas. It is of 3 types. Second, depending whether it is infected or not. So either it is septic or it is bland. Septic means infected, bland means non-infected. The third, depending on the source of the emboli. It can be produced in the cardiac heart, it is known as cardiac emboli. It can be artery, it can be vein, it can be lymphatics. The last, depending on the flow of the blood. Depending on the flow of the blood, it can be opposite to the flow of the blood, it is known as retrograde, or it can move from the arterial side to the venous side, or from venous side to the arterial side through a patent foramen oval. It is known as paradoxical. So these are the 4 type of classification, the 4 criteria of classification we have learned in embolism. Now, we have discussed 4 type of embolism one by one. Thromboembolism, which is produced by a detached thrombus. Fat embolism, it is having 2 causes, traumatic, non-traumatic. In traumatic, there is fracture of the long bone, so that leakage of the yellow bone marrow, the fatty bone marrow in the circulation. In non-traumatic, there is disturbance in the lipid metabolism, lipid emulsification. So it can be burns, it can be sickle cell anemia, and various causes. So 2 theories are there. Amniotic fluid embolism, it is produced in a pregnant lady at the time of the labor due to vigorous contraction of the uterus. There are tears in the myometrium, and from those tears, the amniotic fluid will enter inside the circulation of this lady, producing amniotic fluid embolism. And last is gas embolism. In the gas embolism, it can be certain surgeries of the head, neck, or surgeries of the obstetrics. So accidental introduction of the atmospheric air into the major veins, or either of head neck surgery or in the uterine or endometrial veins. So that is the origin, how they are produced, each of them. Now each of them either present in the artery producing systemic effects, or each of them present in the veins producing pulmonary embolism. So veins are always result in pulmonary embolism, and arterial always result in infarction or necrosis, that is the systemic effects. So each one of them. So here you can see this is a thrombus which got detached and producing thromboembolism. Here you can see the fat embolism, the leakage of the yellow bone marrow in circulation producing fat embolism here. Here you can see this is the amniotic fluid present around the fetus during vigorous contraction. During the pregnancy, during the labor, the amniotic fluid is leaked. It is introduced from the tears present in the myometrium. And this is the accidental introduction of the air into the circulation during certain surgeries. We have also learned decompression sickness. It is one of the type of gas embolism, a special type of gas embolism. It is also known as diver's palsy or Caesian's disease. Here a diver is there. During descent, when he is going down, during descent, the pressure increases, so solubility of the gas increases. But during ascent, the pressure decreases, so solubility decreases. So solubility of the gas is decreased, so it will produce multiple bubbles or air embolism in the circulation, producing various symptoms. So this is diver's palsy. That's all about embolism.